Good afternoon, everyone. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Honourable Premier of Nova Scotia, Tim Houston, the Honourable Minister of Health and Wellness, Michelle Thompson, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Good afternoon. Thank you, Chrissy. Good afternoon, everyone. I need to start today by taking a moment to acknowledge the 3 Nova Scotians who died of COVID since our last briefing. To their families, to their friends, please accept our deepest condolences. The 4th wave is impacting Nova Scotians. Our epidemiology is changing. And as tired as we all are of this pandemic, we have no choice but to keep taking this very seriously. There is no other option. We cannot let our guard down. The proof of full vaccination protocol comes into effect on October 4th. I am more and more convinced how necessary this policy is. It is because of this protocol that fully vaccinated individuals will be able to gather together in larger groups. So thank you to the almost 780,000 Nova Scotians who have stepped up for their families and for their communities to get vaccinated. And to the just under 60,000 Nova Scotians who are eligible to be vaccinated but haven't, now is the time. Some of you don't want to. And I also know that you want to convince me that there is a reason not to get vaccinated. But let me be very clear. I don't agree with you. And no matter how many YouTube videos or conspiracy theories from so-called experts that you send to me, we will not agree. Getting vaccinated is important. For the sake of those around you, please, please get vaccinated. A COVID vaccine during a global pandemic is as important as the use of other vaccines throughout history, including smallpox and polio. There's community spread in the Central Zone, and it is concerning. And Dr. Strang will speak further to that. Please take his comments as further evidence of the need for more people to get vaccinated. It's also why the move to Phase 5 will be a move to a modified Phase 5. We simply cannot remove all restrictions. We had hoped to, but we can't. We will still remove the gathering limits for formal events, concerts, Mooseheads games, Wanderers games, etc., because those events are for those who are fully vaccinated. And Dr. Strang has advised us that the proof of full vaccination protocol makes it safe for this to take place. However, as we move into modified Phase 5, we are keeping our masking policy in effect until the risk of the 4th wave has been reduced. We are also keeping the indoor and outdoor informal gathering limits of 25 and 50. So any house parties or other informal gatherings will be limited to 25 people. And finally, some restrictions will stay in place at our long-term care facilities. You must be vaccinated to attend a long-term care property. In addition to what we're keeping in place, we are also introducing border measures for PEI and Newfoundland and Labrador beginning October 4th, so that the travel restrictions from those provinces are the same as those from people coming from other parts of the country. They'll be the same for these 2 provinces that as we now have in effect for other areas. If you enter Nova Scotia from these provinces, whether you have to quarantine will be based on your vaccine status. This is the same as we now do for all other provinces and territories. So if you're not vaccinated and you want to come to Nova Scotia, you will have to isolate. Furthermore, we are also taking the significant step of implementing a vaccine policy for certain sectors. I can't stress enough how significant of a step this is. Specifically, for some sectors that deal with our most vulnerable, the sick, the elderly, and the very young, we are introducing a mandatory vaccine policy. Minister Thompson will share the details, but I can tell you it will include healthcare workers, long-term care and home care staff, paramedics, and teachers, to name just a few. Simply put, our vaccination rates are not high enough, and we need to protect those who can't protect themselves. People have had ample opportunities to get vaccinated, but there are still too many people who are choosing not to protect themselves and others. We know that there's a very small percentage of people who can't get vaccinated. There will be a process for you to prove that. But for the rest, the time is up, and there will be a clear choice before you. This is not where any of us wants to be. It's certainly not where any of us hoped or thought we'd be. And I want to assure Nova Scotians, I don't take this lightly, and none of us do. Minister.
Thank you, Premier. As a former nurse, I know the importance of vaccination. Vaccines save lives and ensure that many harmful diseases have minimal impact on people. Researchers and manufacturers create and test all kinds of vaccines for all kinds of diseases. Vaccines undergo rigorous testing before they're being approved for use, and the COVID-19 vaccine is no different. Scientists around the world joined forces for one goal: vaccination against COVID-19. And it was an amazing story of global single-mindedness that reduced the time to come up with a vaccine from many years to less than one. The same scientific method and research, the same testing for safety as all vaccines, but everybody put down what they were working on and focused on the pandemic. The COVID-19 vaccines are safe and effective. They are our best defense against the virus that has taken the lives of 97 Nova Scotians. While our vaccination rates are very good, we are in the midst of a fourth wave, and the reality is this: we need everyone to be vaccinated to protect our most vulnerable citizens, our healthcare system, and our economy. We have about 60,000 Nova Scotians who have chosen not to get vaccinated. These are the people at highest risk of carrying the virus, getting sick, passing the virus to others, and jeopardizing finite resources in our healthcare system. That's why we are implementing a vaccine mandate for some sectors in Nova Scotia. The new vaccine mandate will apply to those who work with our most vulnerable, including the elderly, the sick, and the children who cannot be vaccinated. This includes employees of the Nova Scotia Health Authority and IWK Centre, employees of long-term care facilities and home care agencies, paramedics and other EHS staff, Hearing and Speech Nova Scotia, public school teachers and other school-based staff, residential facilities and day programs funded by the Department of Community Services Disability Support Program and certain other facilities, and physicians and other service providers to the above organizations. These individuals must show proof of vaccination. If not fully vaccinated, meaning 0 or only 1 dose, they must participate in an education program, and they have until November 30th to become fully vaccinated. If an employee is not fully vaccinated by November 30th, they will be placed on unpaid administrative leave. Government will not provide additional funds to these sectors to pay for these administrative leaves. This is not a decision that government has made lightly. This is a step we did not want to take, but some of the new cases have demonstrated to us that those who are unvaccinated are placing others at unnecessary risk, especially our vulnerable Nova Scotians. We must take this step for the safety of all Nova Scotians. Thank you. Dr. Strang.
Thank you, Premier and Minister, and I'd also like to echo the Premier's comments and give my condolences to the families of the 3 Nova Scotians who have recently died because of COVID-19. And I also echo what the Premier has said. Now is not the time to stop following public health measures. The 4th wave is clearly here in Nova Scotia, but it is different from previous waves, and our response can be different too. The Delta variant is more contagious and spreads faster than other variants, but 2 doses of vaccine provide strong protection, especially against severe illness and hospitalization. Recent national data shows that unvaccinated individuals are 12 times more likely to be infected than those who are fully vaccinated, and 36 times more likely to end up in hospital. Given Nova Scotia's high level of full vaccination, we can tolerate more spread than in previous waves. Our current daily case numbers are not a cause for alarm and certainly do not require strict shutdowns like we have needed in the past. We can trust the strong protection that vaccines provide. But at the same time, we need to be cautious, watch this situation very carefully, and pay particular attention to the level of severe disease. COVID-19 is very serious for those who are unvaccinated, and the potential to overwhelm our healthcare system is real. Our healthcare system is already at full capacity and is struggling with human resource challenges, and we have to be very careful about how much we demand of that, of people needing more extended care because of in hospitals because of COVID infections. And our hospitalizations are going up, and we've already seen some of the pressures that have resulted in us pulling back on health services in some areas. And we don't want it to go any further. We need to work to keep the virus spread under control. And we will see some breakthrough cases in people who are fully vaccinated, but their risk of severe disease and hospitalization is extremely low. Breakthrough cases are expected and are not a sign that the vaccines don't work. For the Premier, Minister, and I, the coming weeks will be about finding the right balance between opening and public health measures. And we may have to make corrections along the way. For Nova Scotians, it will be about finding the middle ground between being fearful and being complacent. Even though we are opening up in some areas, we all need to pay as much attention to personal measures as we did in previous waves, even if you are fully vaccinated. And I saw the phrase, relax, we're double vaxxed, used this past weekend. But the reality is we can't fully relax, even if we are fully vaccinated. To get us through the fourth wave of this virus as safely as possible, we need everyone in Nova Scotia to stay home if you feel unwell, do the online self-assessment or call 811 and get tested as instructed. To practice frequent hand washing and hand sanitization and good cough sneeze etiquette, coughing or sneezing into your elbow. And even as we open up gatherings, we need to all limit the number of close social contacts that we have, especially outside of our family and work. This is critical, and it's an example of a measure that we've all become too relaxed about. And we need to keep mandatory masking in indoor public places and border measures in place as we battle the fourth wave. We're also expanding our testing capacity back up so we can do 7,500 tests a day. We're planning that over the next 4 weeks, and it will extend beyond that if necessary. And this is the PCR testing that's done through our primary assessment centers. We'll also continue to use asymptomatic testing in a focused and targeted way in areas with outbreaks or as directed by public health. And we still have the 2 rapid asymptomatic testing sites in Halifax and Dartmouth because of the ongoing community spread in the Halifax area. The proof of vaccine policy that comes into effect next week means we can still remove gathering limits and bring larger groups of fully vaccinated people together safely. We've spent the last week or so meeting with partners from business, municipalities, police, tourism, sports organizations, and many others about the proof of vaccine policy. We wanted to talk to them about why we're doing this and answer their questions. And I want to thank all of them who took the time to attend a session, and to all the businesses and organizations who have a role in implementing this policy. It won't be easy, and please know how much we all appreciate your continued partnership and support. Our public health measures have been successful, thanks in large part to your actions. I know some people are upset about this policy, and they don't want to show proof that they've been vaccinated. Some may also be unhappy with continuing mandatory masking in indoor public places. But these measures are necessary for our collective well-being. And even if you disagree, you need to follow the rules. And I ask that you do not take your frustration out on the hostess at the door of a restaurant or the manager of your child's hockey team. They are doing what we've asked them to do, so please be kind. Regardless of your views, please treat one another with compassion, even if you disagree with what we're putting in place. And for those who are fully vaccinated and support masking, please remember that there are some people who cannot wear a mask or get vaccinated due to valid medical reasons. Treat them with kindness and caring as well. I won't say much about the mandatory vaccine policy for healthcare workers, long-term care workers, teachers, and others, as this has already been addressed, but I will say that I fully support this and I believe it is necessary. We've done all we can do to encourage people to get vaccinated voluntarily to protect themselves and others. Whatever steps we take now needs to be stronger. I do expect we'll officially be at 75% of the entire population fully vaccinated by October 4th. But the reality is with the Delta variant that this is not enough. It was always a minimum target and we need to keep going. The health of our province and our citizens depends on it. So to all of those who work in the sectors covered by this policy, I do regret that it has come to this, but you have had many chances to get vaccinated and we have to do this to protect those who cannot protect themselves. Enough with facts and information. I want to end by speaking to you from my heart. Many times throughout this pandemic, I've sat here and talked about measures I was recommending that I knew would not be popular. This has always been about doing the right thing to protect the health and safety of all Nova Scotians. I fully recognize how fed up and tired we all are of COVID. We've asked a lot of you over the past 19 months, and now we're asking for a little bit more. I talked optimistically last spring about being at the end of a marathon, but nature has added another bunch of kilometers with a steep hill or two. You're exhausted and you may want to give up, but we have no choice but to dig deep and keep going. We only have to look across the country and easily see the impacts of people saying they're done with COVID. I care about each and every Nova Scotian, masked or unmasked, vaccinated or unvaccinated, satisfied or angry with me. And I wish I could give you a date that this would be all over, but that's not possible. I will tell you that I hope we only need these measures to get through the fourth wave and until our vaccination rates are even higher, but I cannot give any guarantees. What I can give is my commitment to continue to work with the Premier and Minister to find the best way through this pandemic to keep your collective health and safety as our priority. And so I ask each of you once again to think about your loved ones, your neighbors, those who have cared for or served you over the past 19 months, and commit to doing what is needed to keep them healthy and safe. Let's remember how we have been successful against COVID so far. Celebrate that we are actually able to continue to reopen in a cautious manner while many other places are closing back down. And know that by working together to follow the remaining public health and personal measures, we will get through this fourth wave of COVID-19.
We'll now take questions both in the room and on the phone, beginning in the room.
Premier, I wondered, you and your minister spent most of last week going around talking to health care workers, and they told you unequivocally that they're tired, they're understaffed, they're overworked. What impact will this making it mandatory that they all have their vaccines, what impact might that have on those people who are not vaccinated and don't want to be vaccinated?
You're right. I mean, we definitely heard from healthcare workers across the province how overwhelmed they feel. Drowning was an expression I heard. I heard from a lot of healthcare workers that talk about the level of anxiety that they feel, even knowing that they're going back on shift tomorrow, because they worry about being short-staffed and not being able to do everything they want to deliver care. So there's certainly the feelings of stress and anxiety are certainly there, and we know that there is a certain percentage of the population that just will not get vaccinated, and some of them are healthcare workers. We understand that, but I'm hopeful it's a small percentage. I think we all are, But there's multiple sides to this situation. Number one is we also heard from a lot of healthcare workers that urged us to do this so that they know that their work environment is safe. We also understand that should we have a case in a healthcare facility, possibly from an unvaccinated healthcare worker, it will have dramatic ramifications on the whole floor, on the whole institution. So none of these things are easy. I mean, as Dr. Strang said so eloquently there at the end, I mean, these are all decisions that are tough decisions, but they're all in the interest of public health. We understand there's a risk that we could lose some healthcare workers, but on the balance of things, this is the decision that has to be taken. There's no option right now.
And do you have any idea, or do your minister know how many health workers are unvaccinated currently?
We have some rough estimates on the percentage that's not vaccinated. I think it's there's more healthcare workers. That the rate of vaccination in the healthcare worker population is higher than in the general population, but there are certainly healthcare workers that are not vaccinated. So this policy comes into effect on November 30th, and we are optimistic that between now and then, a lot of people will take that step to get vaccinated, and we'll work very hard to alleviate concerns, to educate people, to try to get them there too. So we're looking at this as an opportunity to help people have the information that they need to understand that it's safe, it's effective, and it's a step that has to be taken right now.
But are we talking hundreds or thousands in terms of either healthcare workers or teachers and those who work in our schools?
I think if you look in broad numbers, and the minister can contribute specifically, but I think if you look in broad numbers, the policy that we're talking about, when you look at the people impacted, those that are working in the civil service, working in healthcare, working in education, we're talking about tens of thousands of Nova Scotians. And if you believe the kind of commonly held statistic that somewhere in the range of 5% of people won't get vaccinated. Now we're talking about how is it a disproportionate in healthcare? Is it so it's hard to say. But there could be an impact. We could lose good people in our healthcare system because they don't want to get vaccinated, and that's a shame. Nobody wants that, but nobody wants any of this. It's a global pandemic, and we have to take the steps that are necessary. So, I mean, we can, as things get closer, we'll get a better indication of the possible impact. I'm concerned. I don't want anyone to lose their job.
Pretty exhaustive list. How come daycares are not?
Daycares specifically, I know Dr. Strang, do you want to speak to the how the list was compiled?
I mean, that was really a decision with education. We've said this is where we're going to start, and we broadened the list of even where we're starting. We believe that this will bring a significant chunk of people not yet vaccinated. Certainly, the awareness within the Department of Education was that they didn't see that there was a significant need at this point in time to include daycares.
There's a lot of anxiety out there, especially among concern for children. You've spoken in the past saying that the risk to children is less than the risk to adults. Can you put some legs on that and give us an understanding of what the risk is to children as compared to adults?
Well, I mean, I can't give a specific number, but we know that the risk of severe disease and hospitalization is the lowest among young children. But it doesn't mean that we shouldn't be concerned about that. We have to limit, spread even within young people, especially with those who have, because of age, have not yet had an opportunity to get vaccinated. But also people shouldn't, and as I spoke about, we need to find a balance between complacency and fear and anxiety. We have to be careful and watch very closely what's happening in our schools, but we shouldn't be fearful and anxious about what's happening in schools.
In the tech briefing, you said there were no children in hospital. Do we have any indication about long COVID among children?
And that's an area of emerging research, long COVID in all age groups, that the possible impacts around COVID infection. And again, there's a lot we still don't know about COVID. So if nothing else, to me, that's another piece of people who don't want to get vaccinated. Well, what are you doing that you were asking everybody to get vaccinated because it limits the ability of the virus to spread, cause infection amongst those who, because of age, can yet be vaccinated. Because even though the risk of acute severe disease and hospitalization is low, we don't yet know about what some of the longer term impacts are. So we should all feel an obligation to protect those who, because of age, can't be vaccinated.
We've known about this fourth wave. We've been in the middle of the fourth wave for a little while. We've seen it across the country for a while. Why mandate vaccines now? Why not, a couple months ago?
Well, I think you always have to, it's a proportional response. Now, because of, and it's really only in the last week or so that we've actually seen the clear establishment of community spread here in Nova Scotia and the Halifax area. So now is the time we need to continue to push. We've been working for a long time to get people through educative means, through increasing access to get vaccinated. But with the fourth wave here and where we need to go to make sure that we protect vulnerable populations, we feel now is the time that we need to layer on a stronger vaccination policy in certain workplaces.
Dr. Strang, I wanted to comment on the fact that perhaps it may appear to some that we're in a whole new pandemic here in terms of it's not the same old pandemic, because they'll look at it and they'll say, well, look at all the people that are vaccinated, yet the measures they're bringing in seems even more strict than at the height of last year. Talk about this. There's a bit of a disconnect there.
So,
Would you explain that to people?
So I would disagree. We're not using the strong measures that we had to use in wave 3, in wave 2, where we shut things down. We had to put significant limitations on the number of people that could get together. We had to close down various business sectors. We are keeping masking. We're keeping limits on informal gatherings, so that's where vaccinated, unvaccinated people to get together. But we're substantively opening up by removing gathering limits, by removing physical distancing requirements. That will have a significant impact on gyms, on restaurants, on all sorts of arts, cultural, sports events that are back to full capacity, the capacity they could have before COVID. So we need to recognize that we're actually in a very privileged position in Nova Scotia because of what we've done in the last 19 months. We can continue to open up, not as much as we perhaps would hope, but we can still continue to open up with the layer of a proof-of-vaccination policy in place, while other jurisdictions in Canada are shutting back down again.
I guess I was actually referring to the mandatory steps that you're taking. There were other mandatory steps before, obviously, but there's mandatory steps now that people talk about their freedoms. And a lot of people say that you're overreaching given the fact that you've got so many people vaccinated. I wonder, can you speak to the importance of why you think you still need to do that?
So it's simply the Delta variant. It's highly infectious. It spreads very easily, and you need a very high level of vaccination coverage. The experts have said that we need 90% of the eligible population needs to be vaccinated. We're close to that with at least 1 dose of vaccine. We're getting closer with 2 doses of vaccine, but we still have more work to do. And that all you have to do is look across Canada and what happens when you open up without getting that very high level of coverage. And I would disagree that people are saying we're being too tough. We're telling people that we need to look after each other. Right now, the way we look after each other, the main way in a pandemic is to get vaccinated, because that protects everybody else around us. And I'm sorry if people don't like that. But you have an obligation to care for your neighbor. Care for the healthcare worker who's going to be there for you if you get sick. I won't apologize for having to take these strong measures to get to the level of safety that we need to have.
I understand there's a voluntary unpaid training program for restaurant staff and event staff on de-escalation. Is there anything that's being done to support these service staff? Many have expressed concerns about the enforcement aspect of this policy.
Yeah, there's an enforcement plan that's coming together now. I think maybe the minister or Dr. Strang can comment a bit further on that, but we understand. We want to support the establishments, and we don't want anyone who's working in one of those establishments to bear the brunt of an angry public or any of that type of stuff. It's not on them. They're just doing their job. So there'll be an enforcement team, an enforcement plan to make sure that we support them.
Yeah, maybe I'll add to that.
Sure.
So we have three main enforcement areas: occupational health and safety, who was around workplace safety. We have alcohol and gaming and licensed establishments, and we had food safety folks in environment and climate change who were there in food service establishments. Throughout COVID, those three departments and those three groups of inspectors have been working together around all the enforcement of all the aspects. Right now, this week, they're developing a comprehensive enforcement plan to start to roll out next Monday. The first step will be education awareness. We're making it very clear that this is a government policy, that it's not the business or the gym's own policy, that this is government. And so if people are concerned about that, express your concern in an appropriate way to government. But my appeal to Nova Scotians, and I said this at the technical briefing, is that we're putting this in place for a purpose. We'll keep it as for the shortest period of time possible to lift it. So there's an obligation on Nova Scotians to once again do the right thing. Even if you disagree with this, if you're not vaccinated, don't go. Don't go to the restaurant. Get takeout. Do another means, and certainly don't show up and try to find loopholes or be disruptive and angry at people, probably often young people, who are going to be on the front line having to ask for your proof of vaccination. And we've also had a conversation with police. They don't have a primary enforcement role, but they are very supportive that if necessary, and there's somebody who's been disruptive and creating an issues at a point of entry, that business can expect to get the support they need from local police to deal with those individuals. But we don't have to do this. If you don't like it, stay away. Don't take it out on the person who's on the front line in front of you.
Dr. Strang, about 60,000 people have simply had no vaccine, but you've got another 46,000 Nova Scotians who have had one dose but not the second. Any idea why so many have not gone the second step?
Some of those, we heard, they were waiting for summer, September. Maybe they needed a bit more of a push or a nudge. But what we're seeing, actually, we've had, over the last few weeks, we had a significant uptake or increase. We're averaging on weekdays, we're averaging over 1,000 people a day coming forward now to start getting vaccinated, and we are starting to see, as I said, though, that numbers of people getting their second dose slowly increasing.
Back again to service establishments, I'm wondering if there is any consideration for compensation for these businesses. Many have expressed to me that they're concerned about extra costs of staffing to have a designated person who's checking proof of vaccines, especially given that this needs to happen at the entrance. Is there any consideration to financial support?
It's something we haven't focused on that. I mean, we can if we hear more, but for the most part, I will say that the establishments that I've spoken to, they don't have a problem with enforcement. They'll make it work. They don't mind checking. So, some of them, if we're talking about bars, they're already checking IDs anyway. I mean, restaurants, sometimes there's somebody at the front to wait. Please wait to be seated. I mean, this is a process. We're all gonna live and learn as we go through this. I personally think it can be done pretty efficiently. But I mean, we'll see how it goes. And if there's feedback, I'm willing to listen to that feedback. But as we sit here today, I think it can happen pretty efficiently.
Dr. Strang, you set for the first 5 phases various targets, numerical targets about where to reach to get to each phase, and more or less that's been followed. Do you have a similar? Is there a metric for when we end phase 5? What kind of numbers we're looking at when life returns to normal?
So phase 5 really is about starting to live this slow transition from acute pandemic response to an endemic response. And right now with wave 4, we're in this transition period. There's a lot we don't know yet about what's the long-term future of COVID. Is there going to be another variant? Also, what is the long-term needs around additional booster doses of vaccine? So we need to let all that science evolve. I'm really focused on the next, 2 to 3 months. How do we get through this fourth wave as safely as possible? We'll let the epidemiology guide this in terms of when we feel we're through the fourth wave, and then the science will evolve about what really probably 2022 looks like. I'm hopeful, cautiously hopeful, that we get into 2022 and we can continue that transition from acute pandemic to ultimately endemic. But we're not there right now. We're as I said, this fourth wave has thrown a curveball at us and made this transition longer and more difficult.
We have to go to the phones. We will now go to CTV's Sarah Plowman.
Hi, this is a question for the Premier. For my colleague, Ross O'Brien, he became known when he fell in his driveway waiting hours for an ambulance. We've learned that he passed away in hospital on Sunday, and his family's been upset over the incident, the care he received afterwards. What can you say to his family today?
Well, I heard about his passing, and it's obviously we're all heartbroken for it, and sincere condolences, and it's that experience I think shook all Nova Scotians and shook people nationally that heard about this. It's just a really terrible situation. It also shook healthcare workers and people working for EHS. So it's had a big impact. And what I could say to the family and the friends is that we understand the challenges in the healthcare system that were certainly underscored by this terrible tragedy. And we'll do everything we can to try and impact that going forward. I know that doesn't do justice to the feelings that they're having right now, and we sympathize with them. We share in their pain.
Go ahead with your follow-up, Sarah.
And yesterday we heard out of New Brunswick that there were some examples of people asking for potentially creating fake vaccine passports. I guess to both of you, of course we haven't initiated the policy yet, but have you heard that this is happening at all, that people are creating fake passports, and what will be done to make sure that this doesn't happen?
Well, I can say, we haven't had that because it's not in place yet, and we're aware of that. We certainly do. Our digital folks are aware of the security issues around that. But again, like so many things, it comes back to what Nova Scotians are going to do. Don't try to look for loopholes. Don't create, ways around this. You're just creating greater risk for your fellow Nova Scotians. So do the right thing, follow the rules, and we'll get through this as safely as we can.
Next, we'll go to Chelsea Gould with the Truro News. Chelsea, are you there?
Hi, sorry. Minister Thompson and Dr. Strang, in the tech briefing you talked about the VaxCheck app coming October 22nd. Is it a requirement for businesses to have the scanning app available for people who do want to show their proof using the QR code?
So I'm not aware that we're making a requirement. I think any business is going to be readily adopt this because it'll make their implementation of proof of vaccine much more efficient.
Follow-up, Chelsea?
Yes, thank you. And would there be any support for businesses to maybe have devices to use the scanning app?
Well, the devices, the scanners themselves are going to be provided free. So we're working on all that right now, and it's part of the policy is to give them the tools, including the reader of the QR codes.
Next, we'll go to Kira Morellen with Radio Canada.
Hi, thank you. I'm wondering, now started sharing about school exposure. Would that be considered as well for a university? Because I know there's been some notices for them, and some people, students go about in our communities. So I'm just wondering if that's something that you'd consider.
So we haven't specifically, universities are a much bigger, more complex environment than a single school. And we haven't in previous waves highlighted, each case that occurs in a university. Certainly if there's been exposure in a portion of a campus, and we have had some, we will provide an exposure notification around that specific location or building on a campus.
Go ahead with your follow-up, Kira.
Yeah, I'm also hearing that with the app that you can get on your phone for Canada Immunized, there's a way to create a fake proof of vaccination, or you say when you got your vaccine, but it doesn't require a picture of the lot number and all of that. I'm wondering if that will be included in training for businesses to make sure that what they're seeing is an actual proof of vaccination.
Yeah, certainly part of the training is what is considered, as while we're in this period of until they get the readers, that what part of our training is what are considered valid proofs of vaccine, what they look like, what the Nova Scotia proof of vaccine. We have other ones, what the military will use, potentially could use. But one of the things we're doing, we're working to if people give us the information, if they're immunized through another vaccine program, they live here in Nova Scotia, then they'll be able to enter and get a Nova Scotia proof of vaccine, and we're going to be encouraging people to do that. So as much as possible, there's consistency in what businesses see.
Next, we'll go to John McPhee with the Herald.
Thank you. I'm just wondering, why wait until November 30th for the mandatory vaccination deadline if the point of this is to get us through the fourth wave? And why not do it October? Is it a matter of logistics? What's going on there?
So it is a matter of logistics. If people haven't begun their vaccination process, we need them to have their initial dose and give them and allow them the time between the recommended time between the two doses. So we need to be fair to people as well if they are moving to vaccination that they hadn't, considered before. And certainly that will give other folks that have their first dose time as well. So that's why the November 30th date is there.
Go ahead with your follow-up, John.
Thank you. Unions such as the teachers union and the nurses union, they've been cool to the idea of a mandatory vaccination policy. Just wondering, were conversations or have conversations been held with these unions on this move, and what was their response?
So certainly we have been in touch with several of the unions to talk to them about the plan today, they were well aware of the announcement today, and I do believe that they will be making their own statements. But we felt that we were supported. Their membership, certainly we've heard from healthcare workers who have contacted us, and I don't want to speak on their behalf, but certainly healthcare workers have asked us in particular to move forward with this vaccination mandate.
Next, we'll go to Ed Halverson with QCCR Radio.
Thank you. I don't notice in any of the literature here, is contact tracing still going to be in effect?
Absolutely. That public health is certainly feeling some pressure with the volume of cases, and we're modifying how we do contact tracing and focusing on the cases that are indicators of vulnerable populations or other complex cases. But certainly we are a priority for public health is to continue to do that identification of cases, the follow up, and all their contacts, and providing them support and advice about what they need to do.
Go ahead with your follow-up, Ed.
Thank you. This question is to the Premier. One of my colleagues already asked about businesses getting support in order to provide the necessary resources for extra staff to check identification, vaccinations. I was speaking with the Mayor of Queens this morning. They're hiring staff at their local municipal rink in order to meet the requirements. And the mayor expressed concerns that they were not prepared to be spending this money. And she's concerned about community organizations who have the same issues. Is there any thought to providing funding for nonprofit organizations who may struggle to staff and meet the vaccination check requirement?
Yeah, we haven't. We haven't given much thought to that. I mean, we haven't made that decision to provide support yet. We'll wait for some feedback. I mean, you're raising something there that I hadn't heard of. I hadn't heard from a certain type of organization, but certainly from a lot of the establishments. The feedback I'm receiving and my sense is that there's going to be a really efficient way to do this. It's not going to be a labor-intensive exercise. So we haven't. I'm not at the point where I'm saying there's some funding that's necessary, but we'll listen to those specific situations like you've just raised and see if there's something that is necessary.
Next, we'll go to Bill Martin with 6 Rivers News. Bill, are you there? Moving on to Lois Ann Dort with the Guysborough Journal. Lois Ann, are you there? Moving on to Pat Healy with the Laker.
Hi, Premier Houston. Businesses have to track customers' vaccine status starting October 4th with the QR code coming in late October. What's your message right now to these business owners who have already spent so much time, labor, and money to stay afloat during the pandemic, to now have to find a way through this until the government releases its own version?
Yeah, I mean, certainly it's been a tough time for many establishments. It's been a tough time for Nova Scotians. But like all these, my message is, you're doing what's right for the safety of Nova Scotians, and thank you for that. It's been raised a couple of times that this might be creating some additional onerous labor requirements, and look, we'll continue to listen to that, but I think that it's a necessary step. We're taking a step that has to be taken, and we want to support those that are supporting the process. So we'll continue to listen, but I still believe, and I'll continue to listen to examples and stuff, but I still believe that there may be a bit of growing pains in the beginning, but I believe this will be a very efficient process once it's rolling.
Go ahead with your follow-up, Pat.
This question's for Dr. Strang. Does the vaccine mandate include those who are volunteer firefighters, and is there any thought to maybe including them?
At this point in time, it does not include volunteer firefighters. We'd have to, look at as we roll out this first group of fairly diverse group of workers, and really learn from that. We haven't heard anything from the firefighting sector, if you will.
Next, we'll go to Eloise with Radio Canada. Eloise, are you there? We have time for one more question in the room. Sean, go ahead.
Just as I understand it, at least this vaccine mandate involves everyone who works for a government institution or provides services to it. But there are hundreds of others who provide health-related services through a private practice. They do not need to get a vaccine. I'm trying to square the circle. Epidemiologically, it doesn't make sense to me. Dr. Strang?
So, I mean, what we're focused on is healthcare workers in institutions that we have a lot. We've worked with, I think you're talking, community-based, a range of regulated health professionals, whether they're physicians, physiotherapists, on and on, working in community. They have robust infection control practices, which they follow, but also many of them, physicians and others, that if they are entering and practicing in like a hospital, or they're a family physician who goes and provides care in a long-term care facility, that work will cover them, require them to be vaccinated. And many of these people are already vaccinated. Many more will get vaccinated because of the general public proof of vaccine policy. So at the end of the day, we don't believe that there's a substantive problem of a range of regulated health professionals with independent community-based practices there, and they're also, many of them are their own employer. So we want to start with the group that we've chosen for the reasons we've described, and we'll focus on getting through that piece first.
And that's all the time we have today for questions. Go ahead, Premier.
Thank you, Chrissy. Thank you, Dr. Strang and Minister Thompson. And thank you again to those of you who have done your part and gotten vaccinated. You're helping our most vulnerable. You're helping your friends, you're helping your families, you're helping your neighbors. You're helping all of us try to get back to some semblance of normal. To the 60,000 Nova Scotians who have not yet had a single dose, if you don't want to do it for yourself, please do it for those around you. As Dr. Strang said, we should be at the end of this marathon. We can get there. But we're not there yet, but we can get there. And you can help push us over the finish line. So thank you.